Good evening and welcome to another CIMG Facebook Live event. I am Dr. Paul Pomilla, Infectious Disease Physician with Calvert Internal Medicine Group. I am delighted to have Dr. Polsky, who is the Health Officer, that is the Chief Medical Officer for the Calvert County Health Department, joining me today.
Pleasure to join you.
Thank you, Larry. As he's done for two other events. So we did a Facebook Live event in March 6th of 2020. It seems like a long time ago. And April 23rd of 2020. Just a word about how we're doing this today. For our first event, which was before the first case in Calvert County, people weren't masking and we did the event together like this. For the second event, we did a Zoom event where Dr. Polsky was in his office and I was here in my office, and we did it by Zoom. And we were planning on doing this event that way as well. But the CDC came out with guidelines for people who've been fully vaccinated, that is, or 2 weeks from their second vaccination, if it's a two-shot vaccination, or 2 weeks after the initial vaccination, if it's the one-shot vaccination. And so he's fully vaccinated, I'm fully vaccinated. Andrew, who is our tech support person, shout out to Andrew for putting all this together today, is fully vaccinated, and he's actually out of the room right now, but he's fully vaccinated. So following the CDC guidelines, we felt that we could do the event this way and it'd be a little bit more enjoyable all around for us and for the viewers. In fact, it was about a year ago that the pandemic hit Calvert County. I don't want to put you on the spot, but I don't know if you know that unfortunate anniversary of the first case in Calvert County. But
So the first case involved a person who's relative. I don't want to go into too much detail, but worked in New Rochelle, New York. They had an outbreak up there. Schools were closed down. Almost everything was closed down up in New York, and the relative from New York came down to stay with the family down here, and that was our first known transmission.
it was mid-March, was it not, or something?
It was just I would say probably, I didn't look at the exact date, I would say probably somewhere around the 10th or 12th, or maybe a couple days later. And then really the first cluster of cases came out of St. Patrick's Day weekend, where there were about 10 couples who did a weekend getaway, and almost everyone ended up infected, and our first death in the county resulted from that outbreak. So when I saw the governor lift some restrictions right before St. Patrick's Day weekend, I will say it brought back some memories, and not really pleasant memories. So I hope everybody's been cautious over this past weekend, and then certainly going in through the Easter and Passover holiday season.
Okay, thank you. And that's a good segue for me to just, on behalf of Dr. Polsky and myself, offer sincere condolences to any of our viewers who have lost loved ones either locally or elsewhere to this virus, and to also I'm being asked to speak up, so a little closer to also to acknowledge the tremendous suffering that we've all experienced, physical, emotional, financial, for many people, all three of those things. And just to acknowledge that. But we're meeting today because I think most, if not everybody, sees some hope for the future in terms of taming, if you will, this pandemic. And that hope is in the form of vaccines. So we're going to be spending a lot of time today talking about the vaccines and other issues of the pandemic locally. And we have Dr. Polsky for his knowledge and expertise regarding that. And so in terms of what we're going to do today is talk about vaccines. Before we get there, I just wanted to discuss very briefly some things we've learned about COVID over the last year or so that got us to this point. And then also just mention three things that I think are here to stay, medically speaking, even after the pandemic's over. And then Dr. Polsky will talk about vaccines and other issues of the pandemic locally, and then we'll take as many questions as we can, and we'll certainly wrap this up in an hour or less. Let me get started about things that I think we've learned. So the first thing is, and I don't want to belabor this too long, but it is the case fatality rate. So when we first met in our first Facebook Live on March 6th, I had guesstimated that the case fatality rate was going to be about 1.5% based on the Diamond Princess cruise situation, where everybody on that cruise ship got tested, and then a certain percentage of people died, which was about 1.5%. And then for our second Facebook Live, I took back that statement and apologized for being inaccurate the first time, because New York City was being hit with and Italy were being hit with a bad outbreak, and it was thought to be about a 7% fatality rate in New York and up to 15% in Italy, and so I had said I'd underestimated. But of course, back then, testing was much less frequent, and so there are a lot of less severe survivors of COVID that never got tested, and so those case fatality rates were, as it turned out, inflated, and now we're back to about a 1% fatality rate, more or less, and it's sort of a moving target. But I think the point is it's about 10 times higher than the mortality rate for flu, more or less. Are you on board with some of these?
Yeah, no, I think those are very, and certainly everything in this realm is a degree of extrapolation, but the estimates, I think, continue to get more and more refined and more accurate, so I agree 100% with you.
Okay. And, 1% is not a bad case fatality rate for certain types of cancer, but the problem is that this disease, like the flu, is so ubiquitous, it's so common, that currently, I think, 30 million Americans have been diagnosed. So that's almost a tenth. It's thought that probably at least twice that many have had it and haven't been diagnosed, and people just don't get tested, they just get through it. And so you have a disease that's affecting more than 10% of the population in a year with a 1% mortality rate or so, and that's where hospitals become overwhelmed, ICUs become overwhelmed, and over 500,000 Americans have died. So enough about that. I think the second thing that we have learned is that I think we have a much better handle than we did back then about the effectiveness of masks. Somewhat infamously, the CDC initially said not to use masks because they're trying to preserve them for healthcare workers. They were in very short supply early on. They quickly reversed that. But and then it was thought that the mask protects others but not yourself. And now I think we have good data that the mask protects others and yourself. And I think that data is mainly twofold. On one hand, there are sophisticated experiments done with masks to see how they trap droplets. And it turns out that N95s and surgical masks are extremely good at trapping droplets, including the size droplets that transmit COVID. Other masks are not particularly good. Bandanas and polyester neck gaiters that runners like to use to keep warm when they're running in the cold are pretty much worthless in terms of protecting yourself or others. But then there are other masks between surgical and N95s that have an intermediate degree of protection. And so we've learned that. And the second part of the data is that most epidemiologic data that looked at mask mandating in communities and such see a decrease in transmission rate after mask mandates are implemented. So I think from both points of view, we now realize that masks are pretty darn effective.
And you all probably will tell that Dr. Pomilla and I did not rehearse this beforehand, so I may be preempting something that he was going to say in a moment. But as I'm sure that everyone has heard about the variants that have come about over the last few months. One variant was first detected in the UK, another in South Africa, one in Brazil. And now there appear to be at least two other variants, one first detected in New York and one in California. And so the concerns right now is that for several, if not all of those variants, that they transmit easier between people, making masks even more important for people who have not yet had a chance to be vaccinated. So the idea that the worst is behind us, we don't really need to worry at this point. There are two main ways that we've learned to prevent transmission. One, as Dr. Pomilla was talking about, are wearing not just a mask, but an appropriate mask. And initially, the thought went from it doesn't protect anybody because the research just was never done, which still astounds me. That we've known about viruses since the 1800s or early 1900s. And during that entire time, nobody's really done this kind of basic research until COVID. So initially, the research that had been done over the past year was showing that it does prevent spray of droplets toward others, but the thought was that it probably doesn't do much to protect the wearer. And then as more research was done and the materials were better understood, we now know, as Dr. Pomilla said, that there's benefit both to the other people in your surroundings, but also to the wearer, him or herself. And so, I think again, it's as opposed to becoming a little bit more blasé about things because at least some people have been vaccinated. With the rise of these variants that are more easily transmitted, it's just as important, if not even more important, to be conscientious about wearing masks.
Thanks, Larry. The third thing that we've learned over time, and I think it's hard to remember a year ago, but I think we had some inkling, but is a better understanding of how the COVID causes people to get ill. And initially, there's a viral phase where the virus propagates and replicates, and in fact, it does most of that even before somebody starts showing symptoms. And then it actually starts dissipating as people are showing symptoms, but what happens is that the body's inflammatory response takes over, and for many people, that inflammatory response becomes very abundant. Even as the virus is declining and in some cases is gone, the inflammatory response persists. So we've got really a two-stage type of system. Do you want to say? Okay, so that leads me to my fourth thing that we've learned, which relates to that, which is treatment issues. Knowing how the virus...
Sorry, I will
okay.
So just to add one thing, because oftentimes the focus is on death, which certainly something we should all be concerned about. But for every one person who dies, there are many others who survive their illness, but end up with very, very long-term and potentially for the rest of their lives, their health will be impacted. And we're still learning about some of these things. So the inflammatory process that Dr. Pomilla just talked about, when that inflammatory process affects the heart or infects the lungs, so the heart is permanently scarred and will never be able to beat as efficiently, those people may end up with arrhythmias down the road, other sorts of chronic health problems. Once lungs become more fibrosed, they never will get back to their same level, being able to transfer oxygen through the body. So as people get older, they will, in a sense, they will prematurely age. And it puts them at risk for blood clots, other sorts of long-term problems. So I think that's been an enormous concern of a lot of physicians, is not just what is going to happen during those few weeks around the time of infection, but what we might be seeing still 5, 10 or more years down the road, myopathy or an inflammation of the heart muscle. There's concern, these are people in their teens and their 20s, professional athletes, in some cases, that they may end up with long-term health effects. So I think, the idea that, I'm only 25 years old, so I don't have to worry because I'm not going to die. Well, statistically, the chance of you dying from COVID is extraordinarily small, but for people who are younger, they may still have long-term health complications because of this inflammation process.
Very good points. So that leads me to my final issue about what we've learned, which is treatment issues. So knowing how COVID causes disease, And knowing that the inflammation is the more important issue, we now know that using anti-inflammatories like steroids later in the disease for people who are critically ill and sick enough to be in the hospital and on oxygen is very effective. However, if it's used too early during the viral phase, then it can propagate and actually cause the virus to propagate more. But later on, treating inflammation is important. Conversely, later on, antivirals have no effectiveness really in treating this because the virus isn't causing the main problem at that point, it's the inflammation. However, early on, there is some treatment available. So there's remdesivir, which is an antiviral in IV form. They're hoping to develop it in oral form, which would be easier. There's monoclonal antibody directed against the virus. And there's convalescent plasma, which is somebody's blood who survived COVID, who's donated their blood, and isolating out the antibodies. It's pretty much the same idea as monoclonal antibodies. Those treatments are effective early on when one is still in the viral phase. Calvert Health Medical Center does have a monoclonal antibody treatment facility now where they're offering that treatment for outpatients who meet strict eligibility requirements where they're early on in the disease, but they're at high risk of developing severe COVID. So that is available locally. But the idea that we're going to come up with a really good antiviral for this would be nice, but it's something that I and many others believe is possibly not going to happen because we don't have great treatment for viral infections in general. So for HIV, after many years of research, we have really good medications that control the disease extremely well, but they're not curative. For herpes virus or shingles virus, we have medication that can control the disease, but that doesn't cure it. It's true for Hep C. In the last few years, they've developed some effective antivirals that, taken for 2 to 3 months, can cure Hep C, but that's more the exception than the rule. So because we don't have great antivirals and the expectation is we may not for some time, that's where vaccines are going to play a role in terms of preventing infection or severe infection to begin with.
And the antivirals that you mentioned, all of them took decades of research. And so although the speed we've seen the vaccines develop for COVID is greatly outpaced other things, I would say realistically we're still looking at probably at least a few years before we have good antivirals. And even if there's an enormous breakthrough and 6 months from now they come up with something, then they still have to go through all the testing. So certainly at this point, vaccines remain or will be the key way to get this infection under control, and not to expect that there will be a medication once someone gets sick that will be significantly curative. There was a question that popped up on our little screen here that I just wanted to touch on because it went a little bit with one of the things you're saying. Someone asked, can a person on a steroid inhaler safely get a vaccine? And because you mentioned steroids as one of the treatments. So steroid inhalers in no way prevent someone from getting the vaccine and in no way compromise their safety. So and that goes for actually any type of steroid treatment, whether it's inhaler or tablets. Now I will say, and I'll be happy to let Dr. Pomilla expand on this if he deems necessary. For people who are taking steroid pills or getting injections, that suppresses the entire immune system in a whole different way. Steroid inhalers really don't have any significant impact on our immune system in general. So the vaccine should be just as effective for somebody who is using a steroid inhaler versus someone who doesn't. The general recommendation that I've been giving is that if someone is taking steroids by mouth or getting injections, they should check with their doctor or nurse practitioner who's been prescribing to see if they think in their particular situation it might affect the timing of the way that the vaccine is given.
Yeah, I agree completely. If somebody's going to be on an immunosuppressant indefinitely, then there's no reason to delay the vaccine, and the vaccine's important because you're at higher risk getting severe COVID. On the other hand, sometimes people are on steroids for a short period of time. Then it may be wise to try to delay the vaccine by a couple of weeks or so after your one is off the steroids. So I'm going to finish up with the my list of 3 medical things that I think are likely to stay after the COVID pandemic is much improved or gone. And then I'm going to hand it over to Dr. Polsky to talk more about the vaccine. So, number 1, no surprise, masks. Even when there comes a time when we don't need to mask for the pandemic, I personally, and probably other healthcare workers, will mask more. Every flu season I would get my flu shot and then cross my fingers and hope for the best, realizing I was exposing myself. And I think next flu season, if we're not masking for the COVID virus, I'll probably mask for my safety and actually so I don't transmit it to other people as well. And I think other healthcare workers might do the same. I think it's possible you may see people in the general population voluntarily masking in crowded situations like has been the custom in parts of Asia even before the pandemic. So I think masks, at least for me, and maybe others, are here to stay.
Right. And one of the things that really has not been talked about to this point, but I'm sure will become more of a topic of conversation as we roll into the start of flu season next year, is the really truly extraordinary decrease in serious cases of flu and deaths from flu. So in a typical year in Maryland, there are thousands of people who die from the flu. I haven't checked over the past 2 weeks, but as of about 2 weeks ago, there were only 3 people in Maryland who died from the flu this year. And it's just
extraordinary.
Out of all the things that potentially I could have predicted, I would not in any way have predicted that dramatic a drop. And one of the things to me that's really key about that is we saw very, very few hospitalizations in general with the flu. Hospitals, including our local hospital, were overrun for a stretch around the holidays and then after New Year's, where people had to be transferred out because we ran out of ICU beds and we ran out of regular hospital beds. If we had also been dealing with flu cases at the same time, it would have really been horrific. So I agree that we've learned that there are benefits beyond COVID to wearing masks. And we know that a lot of cases of the flu for our seniors come from their grandkids. That children pick up the flu in school, and then they are very good incubators of flu virus and very good transmitters. So I'm also interested to see if there will be mask recommendations coming out of the American Academy of Pediatrics and American College of Family Physicians, particularly in pre-adolescents, as to whether they should be wearing masks this coming flu season.
Interesting. Number 2 is telehealth. It's been a godsend for many during the pandemic. And although I'd like to see it decrease in frequency, I think it's going to continue to have a place in certain situations. Certainly for people who have physical or transportation issues that make it very difficult for them to get into the office, or time constraints. Somebody who lives in the county here, who works in DC and has a minor health issue that they could deal with by telehealth. They don't have to take a whole day off from work. So I think telehealth is here to stay in some form or another.
And I spent most of my career actually being a real doctor before I switched over to the health department. And I still do some amount of direct patient care, not nearly the amount that I did back when I was in full-time practice. And I have done some telehealth as well. I agree that there is certainly a role for telehealth. For some people, it enables them to get care where in other circumstances they may not be able to physically get to the office. I've also noticed that in my telehealth visits with my patients, the visits are shorter. People are less apt to really discuss their problems, especially things that are more emotional, that may impact on their health and well-being. And so I would just throw out there that for people who have a very physical health problem. It's a very straightforward, here's my symptoms, I just need an antibiotic, something like that. It may be a very good way to go. For problems that you feel like you really need to discuss, and there's some depth to it with your healthcare provider, I think there is something lost in that personal connection when you're not physically there in the room with someone. And I think there's going to be probably an adjustment period over the next few years as both clinicians, doctors, and nurse practitioners, and when I'm in the patient role, we as patients decide when we're really served best by doing something on a screen and when we really need that personal connection.
Good points. My final thing is mRNA vaccines. I think they're here to stay. Two different ones have proven to be remarkably effective for this virus. They're very versatile, so that if there's a mutation or there's another pandemic, if there's a mutation, a new mRNA snippet can fairly quickly be made and be made into a product. And so for future pandemics and for illnesses like the flu that rapidly mutate, one can develop an mRNA vaccine quicker in general than a standard vaccine. It's not for every situation. For measles, mumps, rubella, for polio, they're very effective vaccines. But where versatility and speed are needed, like the potential future pandemic, which there may be at some point, mRNA vaccines will be very useful going forward, I think.
And they don't hurt. I've both given and gotten a lot of vaccines over my life. And when I got I got Moderna, but the Pfizer vaccine is the same way. Both are mRNA vaccines. Truly did not feel it. And I've probably vaccinated, hundreds of people at this point. And I'm hard-pressed to recall if anyone ever complained that it hurt. So one of the beauties of these vaccines is there are no preservatives in there. And there's almost, it's very pure. So there's really not much in there to cause a reaction to. And we've seen very, very few reactions at all. We've not had any truly serious reactions. We've now vaccinated through the health department somewhere around 9,000 people, and many of them with health conditions and elderly people. And the worst, we've had a few people who have, and this is, I can literally count on one hand the number of people who've needed any medical attention afterwards. So they've been extraordinarily safe and again, comfortable vaccines to get.
Well, I'm done with my part.
All right.
I want to get into vaccines.
So I guess that's a reasonable transition through. When we first started vaccinating, which was just a little bit before Christmas time, I think the last year, which has been very trying for all of us in various ways. But for my staff at the health department and the healthcare professionals throughout the county that we work with, seeing people physically become so ill. Unfortunately, 65 of our Calvert residents have died at this point from COVID, and then to see the suffering among families from that as well. In addition to, as Dr. Pomilla mentioned, economically, emotionally, kids out of school and separated from their friends. There's just been so much that's been trying about this past year that I still remember that the first evening we only got 100 doses, and they all went to first responders, EMS, and then people doing vaccinations and who had been doing COVID swabs up to that point. And people were just so genuinely happy. It was just, even though I knew we had a very long way to go at that point, just the idea that, we weren't playing strictly defense anymore. It wasn't just hiding from the virus, which is what we had been doing for the previous 9 months. We've been hiding in our homes, we've been hiding at work, we've been hiding behind masks. That for the first time, we were actively doing something to protect people from getting infected. And I will say that having been out at our vaccination site through not every day but many days and giving some of those vaccines, that just the relief and the happiness from people who are coming in and getting their vaccines. And I think the only downside, the only frustration is that we don't have more vaccine that we can administer. That this is an understandable but slower than anyone would like to see process of getting supply of vaccine. With that in mind, again, we are making tangible progress. So there are 19,000 residents of Calvert County who have received at least their first dose of vaccine to this point, which is about 26-27% of the adult population. And I'm mentioning that in particular because, as most of you are probably aware, none of the currently available vaccines are approved for anyone under 16, and for the Moderna and the Johnson & Johnson, it's 18 and above. So I'm intentionally excluding children and teens because they're just not eligible at this point. And when we look at seniors, the state data right now, which has some, because vaccines are being given by pharmacies and at mass vaccination sites and other places, our local health department doesn't have access directly to all the data that we would like to have. But what the state is showing is that among our seniors, that about 61% of our seniors have, again, received at least a first dose, and most of them have completed their vaccination series. So we still, again, have work to do, but that is a tremendous amount of progress. We are seeing cases, or we had been seeing cases drop down significantly after the holidays. So we reached our peak in the first into the second week of January, and that was a spillover as too many people got together between Thanksgiving, holiday parties leading up to Christmas time, then Christmas family get-togethers, and then unfortunately New Year's parties on top of that. And we just hit an extraordinary number of cases. I didn't actually count up, I'm just ballparking, but the number of deaths that occurred between early December and the middle of January were probably about 8 times higher than all the deaths we had in the county up until that time. And even over the previous 3 weeks, we saw an additional 8 deaths in the county. And again, as most people are likely aware, from the onset of the illness, for most people who are going to die, it's usually 3 or sometimes even 4 weeks later, so there's a lag. We then saw a significant drop in infections through the end of January and through most of February, and then the last week of February and through this last week of March, we've seen a 75% increase in cases from where we were just a few weeks ago. And so I know there's questions, I've just been glancing a bit here and there for people who have been, who are watching right now. And some of those questions are about, do we still need to wear a mask, and under what circumstances do we wear a mask? So it does seem a little odd to me, and I'm sure it feels strange to Dr. Pomilla as well, to not have a mask on in a room with somebody else who does not live in your household. I will say at the health department, I still have a mask on when I'm anywhere in public. If I'm going to a store, even though I've been vaccinated, 2 reasons. One, the vaccines are extremely effective, estimated about 95%, and there was some data, I'm not sure if how many people saw, but there's some preliminary data out of Israel where they have really led the world in the percentage of their population vaccinated, and their numbers are holding firm with what the initial trials were showing. And actually they're showing right now about a 97% reduction in symptomatic infections and about a 94% reduction in people who have, or we refer to asymptomatic infections. They feel fine, but they still are carrying the virus. So it's extraordinarily good, but 97% and 94% is not 100%. Now, when both Dr. Pomilla and I are vaccinated, so the chances of me at any given time having the virus are very, very low, and then you multiply that. So let's say, I'll just take 0.5. I don't want to get too deep into the math. So 5% chance for me and a 5% chance for Dr. Pomilla. When you multiply those out, we're way less than 1% to for me at any given time to carry a virus and then for that still to be susceptible. So that way less than 1% makes us feel comfortable. But if I'm in a room still with a lot of people, given that the prevalence of the virus right now in our county is still very appreciable, we are essentially right now where we were at Thanksgiving with the number of cases that we're diagnosing over this past week. So we diagnosed 135 cases. We currently have 2 people in the ICU at our local hospital with COVID and several more who are hospitalized. So we're still dealing with a fairly, again, prevalent amount of virus going through the county. So it's more, it's just out of respect for everyone, because you never know who may or who may not, to make sure you're still wearing your mask. Now, my hope is that we'll see 2 things over the next probably 2 months that may, and I don't want to get too far ahead, but may allow us as a community to put the masks aside. The one would be that the prevalence of the virus starts to drop back down. So I shouldn't say continues because it's gone back up over the last couple of weeks. That people are being mindful that the virus is still out there, that they're not taking unnecessary risks, congregating in large numbers. I know there were a few places that I heard about that maybe there were too many people gathering at bars and other places over this past weekend. So hopefully that we won't see a further increase. So if we do see it trending down, and hopefully as the weather becomes more consistently warm, we'll see that'll help out. And the other is that everyone who is at truly high risk from the virus has the opportunity to get vaccinated. And that's not just people in their 70s and 80s, but those are people in their 40s and 50s who have underlying health conditions that put them at greater risk. There unfortunately are plenty of people in their 50s who have had heart attacks. There are people in their 40s with significant, and even in their 30s, with significant diabetes, but they already have some underlying kidney problems, and people with lung issues and all sorts of other problems that put them at higher risk. So my hope is that over these next 2 months that everyone who is at a higher risk will have an opportunity to get well into their vaccine series that just decreases our community risk. And that's the way that I think about it. It's not just my personal risk. It's the risk of the people who are around me, my neighbors, my friends, people I work with, and people that I just interact with at the grocery store and every place else. That I hope that we're all very mindful of our responsibility to look out for everyone in our community. With that having been said, locally we still are very restricted in the number of vaccine doses that we're getting on a weekly basis. Our health department have been getting only 500 doses a week. We can barely make a dent with that. This week we were increased to 600. And the hospital has been getting intermittent supplies. This week they only got 200 doses of vaccine, so still not very much. The pharmacies in the area actually collectively are getting more vaccines than our health department are getting. So not all, but some of the CVS's, Walgreens, giant pharmacies. I don't think our local Walmart or Safeway have gotten any yet. But maybe, actually I take it back, I think the Safeway may have at this point. Most of the doses are going to mass vaccination sites outside of our county, which is just extremely frustrating. That's not a decision that we have any input on. That's made at the state level. This past week and a half, a mass vaccination site was opened just outside of Waldorf at the Blue Crabs minor league baseball stadium. And we were told that they were going to hold 500 doses per week for Calvert residents. And they expected the health department to send 500 names of people to the state so that they could contact people and have people from Calvert drive over to Waldorf to get vaccinated instead of giving us the 500 doses so that we could vaccinate locally. So again, there's just been a lot of understandable frustration. But with that having been said, I'm hopeful that there will be people who are willing to drive over because again, they're certainly they're going to be able to protect their own health sooner and the health of people around them as well. So in any event, the Johnson & Johnson vaccine, which I guess I will touch on, because there's been a lot of questions as to that vaccine, and the testing wasn't as protective against symptomatic infection as the Moderna and the Pfizer vaccine. So some people have been questioning, should they get that vaccine? So I'll start out by saying that I mentioned the 95% effectiveness for the Pfizer and Moderna, the two mRNA vaccines. The Johnson & Johnson, the testing in the US showed 72% prevention of any symptoms, but the most important number out of the trials for Johnson & Johnson was 0 hospitalizations and 0 deaths. Now, no vaccine works perfectly, but we can say that for that vaccine, it's extraordinarily protective against the most serious illness, which is really, we don't want to see anyone get sick at all. But if someone does end up getting a very mild infection, it's not the kind of things we talked about before, where it's not potentially inflaming their heart muscle, and it's not causing fibrosis in their lungs. If the worst is they feel a little bit off for a couple days and then get over that really quickly, and they're also less capable of transmitting to other people, then that's still an extraordinarily valuable vaccine, and people should not hesitate to take that vaccine. So as most people are aware, there's not the option to pick and choose which vaccine that you get. And I would certainly say that if I was advising a family member of mine or one of my patients, I would say if you have the opportunity to take any of the 3 vaccines now, go ahead and do that. Don't wait for another month, 2 months, because again, we're 135 diagnosed infections last week in Calvert, and we know there are others that were not diagnosed. So we can say that there's still hundreds of infections going on every week. And so we want people to take advantage of that extremely good protection from any of the 3 vaccines. The other advantage of Johnson & Johnson is just a 1 dose. So it's not an overriding concern, but for some people it certainly makes it much more convenient. They get their 1 dose and they don't have to worry about scheduling their follow-up 3 to 4 weeks later like the others. In all 3 vaccines, again, safety has been extremely good for all. I'm not aware of a single death related to any of the 3 vaccines anywhere in the country. So I know that there's been a lot of hue and cry about vaccine safety in general, most of that fueled by unfounded rumors that have spread and then further amplified on the internet. But again, these vaccines, the way they were developed, even though they are new vaccines, the technology that brought these vaccines into the vaccination clinics, into pharmacies, it's technology that has been refined over several decades, and now we're seeing really the fruits of all that research. So I don't want anyone to think that just sort of out of nowhere these vaccines just sort of popped up. And I think just the fact that both Dr. Pomilla and I did not hesitate for an instant to get vaccinated. My parents, who are both about 80 years old, have now fortunately been vaccinated. They live up in Baltimore County. Certainly I told them that as soon as they get the opportunity to make sure that they got vaccinated. So I can't think of a higher recommendation than to say that I felt comfortable for myself. I felt comfortable for people that I care about, that I love. And so I certainly have no reservations about recommending for any of my patients or anyone watching. There really are no reasons to avoid the vaccine. If someone has a serious allergic reaction to an initial dose, which again had been extremely rare, then there's a question of do they get a second dose, and I think that would be an individual decision. But any kind of serious reaction, again, nothing fatal to this point, but serious reactions have been somewhere around the 1 in 100,000 range, meaning that if everyone in Calvert County ends up getting vaccinated, at most we would expect that 1 person would have a serious reaction. So again, if you have specific concerns related to health condition or any kind of past medical issues, you should definitely discuss it with your personal physician and nurse practitioner. For people who have had serious allergic reactions to other things in the past, then the question is not so much should somebody get COVID vaccine, because the answer is still yes. It's just a question in what setting should they get vaccinated. And again, that would be something that each individual will discuss with their doctor or nurse practitioner to decide what is safest and best for them.
With regards to that, Dr. Polsky, if I can interrupt,
Sure.
I saw a question earlier on our iPad here about fertility issues in the vaccine, and you are a GYN as well as a public health expert, so I'd like you to address that.
Yeah, so actually I'll talk about that and then maybe just go a half a step further. You should deliver babies. I still have my board certification for OBGYN, and certainly been keeping up very much with the studies that have to do with pregnancy, and not only with COVID, but we have a wealth of experience with dozens of other vaccines in terms of pregnancy and prior to pregnancy. So there is absolutely no risk of any long-term harm to fertility with this vaccine, and I'll get back to if someone at any age gets COVID and they end up with an inflammatory process. We know that inflammation problems sometimes can be a cause of infertility. So I would say that not only do we have very good evidence that there is no impact on fertility from getting any of the 3 vaccines, but there may be a few women out there that actually may be protective of their fertility, so that in the future when they are ready to conceive a child, it may actually be a little bit easier for them. In terms of pregnancy itself, for somebody who's actively trying to get pregnant or someone who is pregnant, the American College of Obstetricians and Gynecologists, which is the leading, I would say actually the world leader in advice for pregnancy, have solidly said that pregnant women should have the opportunity to get vaccinated. And so for someone who is planning a pregnancy, vaccinating at this point is, again, perfectly safe to do, and there would not be any impact on their ability to get pregnant. For someone who is pregnant at this point, I think it's a question of their individual health, given that the vaccine is still limited. So if, and I mentioned I still do a limited amount of direct patient care, and so patients I see are primarily pregnant or they just recently had a baby. If they are overall in good, their underlying health is good, and they're 25 years old, I would not recommend them trying to jump in line at this point. And people who are older, have serious health conditions, potentially diverting a dose away from them. But if I have a pregnant patient who has serious chronic hypertension, has a history of some kind of heart disease, sickle cell disease, anything that puts them at greater risk, I would definitely recommend for them to be vaccinated during their pregnancy. The other is that some of the antibodies that for that woman forms will go through the placenta to the baby, so that after the baby is born, for several months afterwards, the baby will have built-in protection, so that if the baby is exposed to somebody with COVID, the antibodies are already there to fight off the infection. And we see this with a host of other, flu is a classic example. It's strongly recommended for pregnant women to get flu vaccines every year, because not only does it protect them and their baby during the pregnancy, but if the baby is born during flu season, the baby has built-in protection for months after birth.
Thank you. And maybe other questions?
Yeah, well, since we are certainly running a little bit short on time, we should hit some of these. So the first question is, when can I get the vaccine? So that's the, I don't know, I was going to say the $1 million question, but given all these federal packages, I guess it's the $1 trillion question. So we don't know the pace at which the vaccines will continue to be produced, and there have been some supply chain, so I guess one of those terms of 2020, supply chain disruptions. So all I can say is that once you're prioritized, and so at this point everyone 65 and over, and people in certain professions are now, so teachers, frontline healthcare workers, others are now prioritized. Just go ahead and get your vaccine. And there was a question. So there was a question: can we choose which vaccine? So we can take that one off.
Let me just ask a follow-up. So maybe a little solace to somebody who's trying to get a vaccine, but my understanding is that the Calvert County Health Department has gotten vaccine into arms sort of towards the better than most other or all other counties in Maryland. Is that true?
So the week that just ended, 99.8% of the vaccine doses that we've received, we've administered. So why isn't it 100%? Well, honestly, we always hold on to a few because we never know where there might be some special circumstance. So we're not holding on to hundreds, but we'll hold on to maybe about 10 to 15 doses because there may be some special circumstance that arises that we want to have that tiny cushion. But otherwise, yeah, every vaccine we have within that week, we're administering. One of the other questions was, why isn't heart failure on the list to qualify for the vaccine now despite your age? That is a great question. That's because Dr. Pomilla and I don't make up the rules. I think this is a terrible flaw, personally, to the way that access to vaccines were kind of rolled out. So these decisions are made at state level, they're not made on a local level. And underlying health conditions have not been a part of the qualification at this point. So I don't agree with it, but again, I have voiced my opinion on more than a few occasions to the people at state level who are making decisions that I think they should have revised things, but it is what it is.
So that will occur in phase 2. And any thoughts about that you can share about when phase 2 may roll out?
No, and it's not because I want to hide anything. So just for everyone to be aware that when the governor gets on TV and makes announcements, I find out the same time you find out. So when he made an announcement about lifting certain restrictions last week, we had zero heads, and this goes for every health department around the state. We had zero heads up, nor did your county commissioners or anyone else locally.
Interesting.
Yeah. So everyone's got their style. Next one I think we already answered, which is which COVID vaccine has the least side effects and are they safe for everyone to take? So I think just to kind of quickly re-encapsulate, they've all been extraordinarily limited in side effects, and yes, they are safe for everyone. Again, the only qualification there is for anyone who's had serious allergic reactions to something else in the past, just to talk to your doctor or nurse practitioner.
Is it not true that in terms of minor side effects that the J&J, the Johnson & Johnson vaccine, does a little bit better than the other ones?
And that may be the case. I'm hedging a little bit because we just haven't had, this is based on trials where it's still, there are tens of thousands of people, but until we see hundreds of thousands of people, I always like to be a little bit cautious about making pronouncements, but certainly we have no reason to think that there will be any more side effects, and yeah, it very well may turn out, because the data that's come out of trials, I think that our real world evidence, as it's more and more people have gotten vaccinated, has very much held to what the trials have shown us. So next is anyone testing to see if we have antibodies after we receive the vaccine? So yes, and this will sort of blend into a couple other questions. So when research was being done, we had data already on antibody production after people were naturally infected. So somebody gets infected out in the community, and so there's a range of how much antibody, what we call neutralizing antibodies, the most important because we produce different kinds of antibodies. So the neutralizing antibodies, there's a range of how much is produced by different people's immune systems after a natural infection. The levels after the vaccines were higher than what we saw for natural infections, and the levels that the neutralizing antibody remain in the bloodstream seems to last longer with the vaccines than they do with natural infection. So both of those are a plus, and that is the reason why it is still recommended for people to get vaccinated even if they have already been diagnosed with COVID infection, because the expectation is that with vaccination, your immunity will last longer and likely be more protective over time. So what we've been recommending is what, along the lines what the CDC is saying, is that if someone has had a recent infection within the last 3 months, they don't need to jump to get another vaccine, although there's no harm in doing that. But we do recommend if it's been at least 3 months since someone had an infection, that they should go ahead and get vaccinated if they are in one of the qualifying groups. If one has received the first dose of Moderna but missed the window to return for a second, can that person safely receive the Johnson & Johnson vaccine? So the recommendation is that once you start with one, you stick with one. And so the answer to that question is no, don't get the Johnson & Johnson, but go get the second dose of Moderna. So although it is ideal to be vaccinated sort of on schedule 4 weeks after the first, and the CDC recommends ideally by week 6, again, we have lots of experience from lots of other vaccines, and we know that even if that subsequent, because lots of vaccines, it's in series, that if the second dose is delayed, the protection is still extremely good. And so we don't know at this point, although there are a few trials going on, what happens if you sort of mix doses. We honestly don't know how that protection would roll out. So yeah, whether it's Pfizer or Moderna, if you are late for your second dose, notify wherever you got it. If it's the health department, let us know. If it was at CVS or wherever, contact them. And then if it's at the health department, we will get you in usually within the next week to get that second dose. Will Calvert County be getting the Johnson & Johnson vaccine? So we got 100 doses 2 weeks ago, we got none last week, and we're getting none this week. We don't know what next week is going to bring. And so again, the advice, I don't want to sound like a broken record, but the advice would be that whichever vaccine is available, that is the best dose, that is the best vaccine for you. How long are we protected after getting the vaccine? Did you want to take one, or should I keep rolling?
No, keep rolling.
All right. How long are you protected after getting the vaccine? So we're not certain of the answer, but I will speculate. And this is on the presumption that we don't see variants that we may need to kind of retool. So assuming that we're kind of status quo with things, my guess is probably 2 to 5 years, purely a guess. But I would say that we've seen after natural infection, we're now getting over a year. We have seen some people get reinfected, and we're particularly concerned. I know in Brazil, a lot of people who were infected with the original strain of the virus got seriously ill with what's now sometimes called the Brazilian variant. But for the original strain, we've seen relatively few infections even a year out. And given that we have every reason to believe the vaccine will be more protective for a longer period of time, I think it's likely at least we'll see a few years of protection. Typically with coronaviruses in general, immunity is not lifelong. So I do expect it'll wear off at some point, and this is one of those that time will tell. My guess is that because of mutations that arise, we will have booster shots to cover those variants. Maybe the Brazilian variant, it might be something that has not arisen yet. And so that may also help to maintain immunity going down the road. And I also throw out, that's another reason for people not to wait to get vaccinated, because the more infections continue to perpetuate, the more opportunities for mutations to arise. So the faster people get vaccinated and the quicker we can blunt the spread, the less potential there is for mutations as we roll into the summer and then into next fall and winter. If someone had COVID...
If I could just interject, just to reiterate that, I think our future is based on how well we continue to social distance, mask, and vaccinate versus the race against mutant viruses that may be resistant to the vaccine. And that's the race, so we have our part to do.
So next question is, if someone had COVID, do you recommend to get both vaccine shots? And then there's a second question, will there be any potential side effects from either of the shots for a person with COVID in the last 3 months? So certainly no dangerous side effects. We don't have enough evidence to show if perhaps, so we know that when I got my 2 doses, my first dose, my arm was sore for a couple days and that was it. I really felt perfectly fine otherwise. When I got my second dose, the day after I had my vaccine, I definitely felt off. I was able to go to work. I made it through the day. I kind of crashed around maybe 8:30 that night, just went to bed. When I woke up the next morning, I felt perfectly fine. So I wouldn't be surprised if someone who, especially if they've relatively recently had the virus, that their first dose may feel more like some people's second doses, but again, we don't have really good information to base that on. There is research going on right now as to whether a single dose would be adequate, but we don't know. And so the national experts are recommending at this point, until we have clarity on that people should not leave themselves potentially vulnerable, and they should complete the entire vaccine series even if they've had COVID before. And I think that's certainly prudent advice. But it'll be a wait and see, and as soon as we have more data, sometimes we forget that we are learning as we go in some respects. And that we just have to accept that we don't have all the answers to every question right now. And so again, as we will get an answer to that question, but it may not be for many months to come. And then certainly that will be shared very quickly.
Talking about questions, I'm going to interject quickly. We're approaching the hour mark.
Yeah.
We said we'd keep it at about an hour, but maybe there's just another question. I'm really enjoying this. I think our viewers probably are. There's another question or two for you,
Sure.
Dr. Polsky.
So that one's yours.
Oh. Does CIMG offer ivermectin as treatment? So there's really very preliminary data. The answer is no. There's very preliminary data about ivermectin as well as a lot of other treatments. In the test tube at very high doses, it might work. There's no studies really in humans. There's anecdotal data, and that's not good enough to promote its use at this point.
Is that true? More.
Okay.
But I do want to take a moment because oftentimes, purposely, we dwell on the bad stuff, and we sometimes forget that there are a lot of things we're doing well. So I did, not to embarrass Dr. Pomilla while he's right here, but I do want to take a moment to recognize all the clinicians in the county who I think have done an outstanding job in helping to guide their patients and to make sure that people have been getting tested. We may be the only county in the entire state of Maryland where every primary care provider provides COVID testing in their offices. And I will say Calvert Internal was the first group in our county back in April, I think, that started testing.
March, maybe.
March. It may have been, yeah. It was very early. And to me, linking, and I always cringe a little bit for these like mass testing sites. People are just going in for a swab and then they're just going on their own. And sometimes those first 24 to 48 hours are sometimes critical, especially for people with underlying health problems. And that the clinicians all across the county have really stepped up and helped. And that's, I think, a very big reason, along with, for the most part, people that I've seen locally when I'm out and about have been doing their jobs, wearing their masks, keeping reasonable distances, that the number of people who died in our county are substantially lower than what we're seeing across the rest of the state. If the number of deaths in Calvert were keeping in proportion to the number of deaths we've seen statewide in Maryland, 121 Calvert residents would have died at this point. And although 65 people have died from COVID who live in Calvert, it means that there's 56 people who are likely still alive right now because of all of the precautions that many across our county have done. Again, wearing their masks, consistently being more mindful of not putting themselves into large group settings, and then on the other side, for our healthcare providers, who I think have done a tremendous job of both advising and making sure that people's underlying health conditions were being optimized, so that people that have heart conditions and diabetes, that their blood sugars were under better control, and that all those supportive measures. So Dr. Peruz and his team in the intensive care unit over at the hospital, all the nurses and doctors in the emergency department and on floors, the non-ICU floors over in the hospital have been doing great work as well. And now that we also have the monoclonal antibody available locally, just one more way that we can try to make sure collectively that we keep each other healthier and safer until we can get enough people vaccinated.
Well, I'm going to return I thank you for that. I'm going to return the compliment and say you've done a great job of keeping the practitioners in the county informed in a manner of ways, including email, and so communication may not be great state to local or whatever, but locally communication is great thanks to you and your team there. And I want to thank you very much for taking time out of your extremely busy schedule to be with us tonight. Thank you so much.
When I told my wife I was going to be late coming home yet again, she just kind of shrugged. She's given up.
All right. Thank you so much, and thanks for joining us.